Welcome back to Wichita's Biz That Is. I'm Tim Witzman, and our guest today, Ann Nelson, the Executive Director of the Central Plains Healthcare Partnership. We were talking about the funding. I have noticed in the press recently that there have been some cuts. Can you talk about what's happened there and what the implications are?
Our funding support from the public sector has eroded. Over the last 2 years, the City of Wichita has cut our program by $75,000. And then at the Sedgwick County Commission meeting last Wednesday, the Commission cut our current funding for this year by $34,000. So we're concerned about that. We have had a three-way funding partnership, if you think of a stool with three legs. And as those two legs become wobbly, we're concerned about the stability of Project Access. So we're advocating very strongly with elected officials to continue supporting the hub that is Project Access.
There are other Project Access or similar programs around the country. How's this one compare?
We are the first replication site for the program that started in Asheville, North Carolina, and since that time I've worked with over 100 communities helping them set their programs up. I know of about 50 that are running very effectively and doing very similar work. I will say that we've received some national attention, national awards, and I hope our medical community in Wichita and the rest of the community supporting Project Access understands that we're kind of a standard bearer for other programs throughout the nation.
Programmatically, what do you have? Do you find the doctors? How does that work?
We have a recruitment effort every year, and just last year we identified 30 new physicians to sign up. As physicians leave the community or pass away or retire, we have to find new physicians to fill those spots. And the hospitals have been ongoing partners with us from the very beginning, including Via Christi and Wesley. They donate inpatient and outpatient care. So we have a continual recruitment effort that we do every year.
Now, your organization was it started by the Medical Society?
Yes.
Of Sedgwick County?
Yes. Local cardiothoracic surgeon, Dr. Paul Ulig, heard about the program in Asheville, took teams of people, flew them out there, came back, and it really has been based within the physician community and led by, and really they feel a deep sense of ownership about Project Access since the beginning.
Very good. Yeah, I don't think people always understand some of the organizations that contribute things. One thing that just annoys me all the time is people will walk in and talk to me about, well, nobody does such and such. And I think, oh yeah, there are people working on that. You just don't know who they are.
That's why
the community.
This show is so important, and the opportunity for us to highlight Project Access with you and your program so that we can tell the community what we're doing.
Absolutely. Let's talk more about perhaps the needs. And, with Obamacare coming in, that had all kinds of implications. We were working on a program to try to find kind of a way to pay for people who didn't have care, some of them. From our perspective, we were looking at some of the smaller businesses that can't afford to do health care. But that was all very complicated, and we were trying to figure out sources of funding, private funding, maybe some government funding, some fees. We wouldn't have covered everybody. Just tell me a little bit more about what those needs are that we were trying to serve.
I think I'd like to dispel a myth while we're talking today, Tim, about who the uninsured are.
Okay.
They are your barbers and hairstylists and daycare providers and preschool teachers and meal servers at restaurants and retail workers. It is the service sector in our economic framework. And I so often hear if they got jobs that they could get insurance, we wouldn't have those needs. But we're essentially, when someone says that, it might work for a person or these 5 people or those 10 people, but we're talking about eliminating the entire service sector, which remains uninsured, and small business owners. We have many small business owners enrolled in our program because they have brain tumors and health issues that they need care. So the needs are great.
Yeah, one of the things that annoys me, both political parties, I'll stay nonpartisan on this one, is not asking people who are familiar with things how things work before they have programs or eliminate programs, either one. I remember when the Obama administration came out with their tax credit for small businesses, and it was scaled. You had to have really low incomes, et cetera. So the press came to me and they said, well, what do you think? And I said, some will take it, but not very many. And they said, why? I said, well, if they can't afford it, a 15% credit isn't going to change that.
Doesn't matter.
It's not enough money to
No.
make the difference. And then the Office of Management and Budget did a study a year after it came out, and they achieved 5% of their goal.
Wow.
But it's typical to me of people who think you can sit somewhere, whether it's Washington or Topeka or Wichita, turn dials and people will do things. And they don't have any real understanding of how does that work. I wish they would more often ask the Ann Nelsons of the world, come sit down with us, talk to us about this, you know, so that they could understand before they make policy how to do those things.
I agree with you, but I would add something to your comment, and that is I feel it's my responsibility to educate other people about the needs in the community and about what's already happening. And the needs our program, are facing every day. So we take the opportunity whenever we can to schedule meetings with elected officials and other people like you, the opportunity to be interviewed today, because I need to educate people throughout the community, both in public settings and in private settings, about what those needs are. And we find often that we build friendships and partnerships that we wouldn't have expected otherwise.
Well, Ann Nelson is very good at the friendships part. But we're going to take another break on Wichita's Biz That Is, and we'll be right back.